Hi everyone, my name is Yesenia. I'm going to be talking about the theoretical basis for our position and support of the Affordable Care Act. So the goals of the Affordable Care Act are to expand Medicaid, preserve employer coverage in Medicare, grant states control of insurance markets. This is according to Luther and Hart. And according to Luther and Hart, the goals of nurses are to promote health, navigate chronic illness, and prevent the development of secondary conditions, all of which align with the triple aims of the Healthcare Reform Act. So the majority of nurses in the United States do support the Affordable Care Act, and they think that it'll be beneficial to Americans and also to the healthcare field. And it shares similar ideas because we both have the goals of improving access to healthcare, eliminating health disparities, and also focusing on health promotion. The transformational leadership theory, according to Grover and Murray, is a process of influencing followers through creating relationships that focus on vision and values. So nurses who adopt a transformational leadership style can have positive influence on others in the healthcare setting. Nurses can use their power to influence other nurses as well as other healthcare providers to support the Affordable Care Act in order to improve access to healthcare. And another provision of the Affordable Care Act focuses on promotion of health and prevention of disease. So this closely coincides with Mola Pender's health promotion model, which looks at environmental and personal factors that encourage and discourage healthy behaviors. It focuses on eliminating barriers to health, which one of the biggest barriers to health for people is being able to afford healthcare. So nurses who utilize the health promotion model with patients can help them gain insight about their healthy and unhealthy behaviors so that they can make changes to better their health. And it can also help patients improve their health care. So with the Affordable Care Act, more people will have access to health care than ever before, and this can be beneficial to improving their health. Preventative care is very important, and the Affordable Care Act makes it possible for people to have access to primary care providers and obtain preventative services, not just secondary treatment for illnesses. The American Nurses Association has the ethical principles and has the code of ethics, which help guide nurses in ethical decision making and in providing quality and safe care to patients. Two main ideas of the ANA Code of Ethics include improving access to healthcare and decreasing health disparities. And then there's also the principles of bioethics, which are commonly used in nursing and other healthcare fields, which include respect for patient autonomy, beneficence, non-maleficence, justice, and fidelity. So the principle of justice implies that nurses should treat all patients equally, regardless of their cultural, social, economic, and ethnic backgrounds. All patients should have equal access to healthcare, regardless of their ability to afford healthcare. And the Affordable Care Act makes it possible for patients with limited income to receive quality healthcare. Beneficence means doing what is best for our patients. And since the Affordable Care Act has many positive aspects, then it can be beneficial to the health and well-being of patients. The transcultural nursing theory founded by Madeline Lerner is very important, especially because now with the Affordable Care Act, more people are having access to health care, and these people are of different cultural and ethnic backgrounds. So the transcultural nursing theory states that nurses should provide care that considers the person's cultural values and beliefs, and then also notes that nurses should gain cultural competence because patients are more likely to utilize the healthcare system if they feel that their cultural values are respected by healthcare providers, especially nurses who have more direct patient contact. Another idea is patient advocacy, which is a common practice in nursing. It means that we respect patients, we advocate for patients, we treat patients with dignity and respect. We ensure that patients receive safe, effective, quality care, and we ensure that patients receive informed consent. And this includes sharing knowledge about the Affordable Care Act and how it affects patients, and also by helping refer patients to social workers, case managers, and helping patients enroll in the Affordable Care Act and in the, to gain access to healthcare and helping them choose a plan, helping them choose a healthcare provider, and just also teaching them about health promotion and preventative care and just how to be healthy. Thank you.